Hello future nurses, hope you're all doing well. This is Manjot from Pro RN coaching classes. Together we can conquer this. Today we are going to talk about myocardial infarction. So let's start with this. What is myocardial infarction? So it has three different things which I want you to understand when we talk about myocardial infarction. So I have divided the definition of this term in three parts and we will talk about all these parts one by one. Let's start. So it is sudden restriction of blood supply. So myocardial infarction होता है sudden क्या एकदम से जब blood supply हार्ट के मसल को बंद हो जाती है, sudden restriction of blood supply, where second part is कहाँ पे हो रहा है, to a portion of heart. It happens when there is a sudden restriction of blood supply to a portion of heart. It could be any portion of heart. ये depend करता है कौन सी artery block हुई है. So वो particular area heart का वहाँ पे ऑक्सीजन की सप्लाई नहीं जा रही, तो उसके बाद क्या होगा? थर्ड पॉइंट, then फिर क्या होता है? Causing ischemia and death to the muscle tissue. So as we have just talked about, myocardial infarction is sudden restriction of blood supply to a portion of heart which leads to decreased oxygen supply and ischemia. जब हार्ट के किसी पोर्शन को ब्लड सप्लाई एकदम से रुक जाती है, तो वो पोर्शन जब ऑक्सीजन उसको नहीं मिल पाती, तो इश्कीमिया होता है उस पर्टिकुलर एरिया में. और आई वांट टू टेल यू वन मोर थिंग, myocardial infarction is a process. It takes time. It may take hours or days to happen, and also if there is no blood circulation at all to that particular area, और अगर ये वापस से circulation को नहीं correct किया गया या फिर fix किया गया, वो particular area necrosed भी हो सकता है. Necrosis क्या होता है? Death of muscle tissue. So it is very important to find out this disease or this condition as soon as possible. Now, how do we know that someone is having myocardial infarction? Let's talk about the data collection or the symptoms of this disease. If we look here, the first one is pain. When there is no blood circulation to a particular portion of heart, the person will present with pain. कैसा पेन होगा? पेन, it's called angina. आपने सुना होगा बहुत बारी जब पेशेंट कंप्लेन करता है चेस्ट पेन, स्पेशली टू द लेफ्ट साइड, क्योंकि हमारा हार्ट लेफ्ट साइड पे होता है. और इस चेस्ट पेन की स्पेसिफिकेशंस कुछ होती हैं. जब पेशेंट कंप्लेन करता है चेस्ट पेन की, देन वी वांट टू नो इफ दिस पेन इज एंजाइना और एनी अदर पेन कॉज्ड बाय एनी अदर मसल in the body. So then we ask the patient, is this pain radiating to the shoulder or your back? So because जो chest pain होती है उसकी एक जो specific चीज होती है, जो heart में जब angina होता है तो वो radiating pain होता है. It is bad pain, it radiates to shoulder, it radiates to back. So the first one is pain. Second one is nausea and vomiting. You may see some of the patients presenting with myocardial infarction who may be very nauseous or even throwing up. Third point is diaphoresis. So वो उनको बहुत पसीना आएगा. They will be very diaphoretic because this pain is really bad और बॉडी को बहुत ज़्यादा एक्स्ट्रा वर्क करना पड़ रहा है उस चीज़ को कंपनसेट करने के लिए. हार्ट को एक्स्ट्रा वर्क करना पड़ रहा है उस चीज़ को कंपनसेट करने के लिए. डिस्निया, ऑफ कोर्स अभी हार्ट का कोई मसल है, उसको ब्लड सप्लाई नहीं जा रही, तो हार्ट को काम करने में दिक्कत हो रही है. ब्लड सप्लाई वो बॉडी को कैसे भेजेगा जब हार्ट खुद को ब्लड सप्लाई नहीं जा रही? सो ब्रीदिंग डिफिकल्टी होती है ऐसी सिचुएशंस में. डिसएरिथमियाज, तो हार्ट का रिदम जो है वो नॉर्मल से चेंज हो जाता है. fear and anxiety, इतना ज़्यादा pain patient को हो रहा है, definitely they will be very anxious at that time, paler and cyanosed. In worse conditions they will look pale, और कई बारी तो साइनोसिस क्या होता है, ब्लू डिस्कलरेशन, एक्सट्रीमिटीज की ब्लू डिस्कलरेशन देखने को मिल सकती है इन सीवियर केसेस, बिकॉज ब्लड सर्कुलेशन जो एक्सट्रीमिटीज को नहीं अच्छे से जा रही. देन वी कम टू कूलनेस ऑफ एक्सट्रीमिटीज. दैट इज वन मोर साइन ऑफ पुअर ब्लड सर्कुलेशन टू द एक्सट्रीमिटीज. अगर हाथ पैर ठंडे हैं, दैट मीन्स ब्लड सर्कुलेशन में प्रॉब्लम आ रही है. Let's go to diagnosis. So now patient is presenting with all these symptoms, and what are we going to do in healthcare facility to find out if this is related to heart or if this is myocardial infarction. So diagnostic test में सबसे पहला आता है cardiac enzyme test. Cardiac enzyme test में 4 तरह के enzyme आते हैं. So I want to tell you, so these all enzymes are secreted by the muscles of heart when there is a damage to heart muscles. But the difference between all these enzymes is कि हर एक enzyme के release होने का time and peak करने का time एक दूसरे से अलग है. If we talk about troponin, जब हम troponin टेस्ट करते हैं patient with chest pain, तो troponin पहले 3 घंटे after the damage, जब infarction heart में शुरू होता है, 3 घंटे में इसकी जो वैल्यू है ये ब्लड इंक्रीज हो जाती है, and it keeps peaking for 7 to 10 days. तो इसका मतलब ये है कि we can keep checking troponin until it peaks for the patients who have been complaining of chest pain. और इसी तरह से बाकी के enzymes जैसे CK, creatine kinase, myoglobin and CKMB isoenzyme. So we will test for cardiac markers for the patients with chest pain. उसके बाद then we will do WBC count. When the patient presents with myocardial infarction, their WBCs will be increased, elevated. Then we'll do ECG. Of course, when it comes to heart, the rhythm may be altered. So to find out dysrhythmias, we have to do ECG. उसमें हम mainly ST elevation, STEMI, myocardial infarction होता है STEMI या फिर NSTEMI. इसको ये 2 तरह के ECG में alterations देखने को मिलती हैं, और उसके बाद T wave inversion भी देखने को मिलता है. Then we'll talk about cardiac catheterization. तो ये किया जाता है in the cases when we have to immediately resupply the blood to a particular area of heart. तो वो catheterize करके they will find out how much is the blockage. तो उसमें वो कई बारी उस catheterization के through उस clot को remove या फिर destroy भी किया जा सकता है at the same spot. So these were the diagnostic tests. Now, how are we going to manage this condition? We have a patient with myocardial infarction, crying with chest pain. We have done the diagnostic test to confirm yes, the patient has myocardial infarction. Now, what are we going to do? Let's start. First thing is description of chest pain, which we do when we collect the data. We know what kind of chest pain it is, how much would they rate out of 10, you know how we do the pain scale, or if it is radiating or not. Second thing, oxygen as prescribed. So when a patient comes with chest pain, because the pain makes it worse too, but their oxygen requirements increase because heart is not able to pump the amount of blood the body needs for oxygen and the blood. So हम उनको oxygen provide करेंगे, nasal prongs के through will supply oxygen to the patient. Third point is pain management. It is very important that we control the pain as it also increases body needs of oxygen. So we'll give prescribed medications to control the pain. Bed rest in semi-Fowler's position. Bed rest is very important in this situation because the more they exert themselves, the more requirements for oxygen increase and the more the pain increases. जितनी movement, जितनी exertion होगी, pain उतना ज़्यादा होगा और worse condition होगी. So we put these patients on bed rest and the preferred position is semi-Fowler's position. Then we talk about cardiovascular and respiratory assessment. जब कार्डियोवैस्कुलर असेसमेंट की बात करते हैं, देन व्हाट कम्स, विल डू देयर वाइटल साइंस, ब्लड प्रेशर कहीं टू हाई या फिर टू लो तो नहीं है, हार्ट रेट बहुत ज़्यादा हाई तो नहीं है, उनकी सैचुरेशन कितनी है। हम रेस्पिरेटरी असेसमेंट में लंग्स की साउंड देखते हैं। समटाइम्स यू मे लिसन क्रैकल्स or wheezing when you are assessing a patient with such conditions. उसके बाद 12 lead ECG, as we have already talked about it. इस ECG में we may find STEMI or NSTEMI, T-wave inversions, alterations, or we can also check the rhythm of the heart, which may be altered. Thrombolytics, beta blockers, and lab values. So we have to keep an eye on the lab values. Remember, we talked about cardiac enzymes. We have to do the blood works for the patient and check the lab results for any alterations. We have to give them the medications, especially beta blockers, to control their heart rate. Some patients may also be getting thrombolytic agents because there are chances of stroke as well. So we have to prevent any kind of clot formation in the body. उसके बाद है peripheral pulses. So we have to assess the peripheral pulses when we do cardiovascular assessment, because there might be diminished peripheral pulses because of the low blood circulation to the extremities. और आपको टच करके देखना है कहीं बहुत ठंडी तो नहीं, कूल तो नहीं extremities, because it has to be warm. Warm तभी होती है जब अच्छी blood circulation होती है. Any kind of cyanosis, blue discoloration to the extremities is also a sign of warning. So इन सब चीज़ों का हमें ध्यान रखना है. So we hope that you were able to understand this topic. If you have any question, you can leave a comment, or if there is any topic you would like us to explain, just leave it in the comment section. Do not forget to subscribe our channel, comment and share our videos. And if you want any assistance with coaching for your nursing exam, you can contact us on the numbers given in the link below. And thank you for watching ProRN. Together we can conquer this.